Jesse, good morning. It's Peter Roskam. Thanks for coming on.
Hi, Peter. Thanks for the invite.
Can you just tell us a little bit, give us some insight, what ends up happening if the day comes and goes and the public option is not a part of this mix? Let's assume for the sake of argument that there's some grand compromise. What are the dynamics within the Democratic base? And you can give us some insight on that.
Well, I liken the next election to that of 1862, when Abraham Lincoln, when he was sworn in as President of the United States, states were leaving the Union. He had to focus on a single message, and that is saving the Union. He did not transition the conversation into emancipation or into the issues of slavery. He just argued that the Union needed to be saved, and we didn't need to expand the peculiar institution, and that's the language he used, the peculiar institution, into the Western territories. And so he sought to save the Union. He kept key coalition states, congressional districts, Senate districts, into the Union, even though they were supportive of the peculiar institution. And then after the midterm elections and several key victories and battles, Abraham Lincoln then transitioned from saving the Union to not only saving the Union and making it more perfect, but also emancipation.
Jesse,
the point that I'm making here is, yes, sir?
This is Rob Andrews. How are you this morning?
Hey, Rob, how are you?
I want to ask you a question. Some of the criticism about the public option being something people are going to be forced into and socialized medicine and all this. What do people in your district think of Medicare? Do they like it?
Of course they do. And Medicare is the public option.
Yeah, exactly. How does Medicare compare to the public option?
It is the public option in our nation's healthcare system right now, just like the Veterans Administration is also the public option. But I want to be crystal clear about the example that I was just giving. The midterm elections, Peter, could have profound implications for the Democratic base, for activists who've been advocating for universal coverage for a number of years. And so if that base is turned off, there could be complications for the Democratic House going into the next year's elections.
All right, one quick point. Congressman Andrews, you just brought up Medicare. Isn't the bigger problem the cost of expanding Medicare beyond?
Yes, and it's one of the reasons why part of the way this bill is paid for is changes in Medicare that stop practices like selling people wheelchairs who should rent them instead of buying them, like not paying people for the number of MRIs they do, but for the quality of the outcome they get.
Instead of renting them.
Yeah, well,
efficiencies in the system.
Right, efficiencies. That's why we're doing that.
Here's the
almost $500 billion worth of that.
Here's the other piece about Medicare. There's high patient satisfaction rates if you're a senior. But if you look at the backlot tour of Medicare from a financial point of view, it's a house of cards. Medicare is paying 75 cents on the dollar to providers. So using that as an actuarial predicate upon which to build a system isn't going to last.
About this payment of the providers, and I think Jesse would be familiar with this argument too. One of the arguments against the public option based on Medicare is that hospitals and doctors will leave the system because they're underpaid. In the last 10 years, 1.9% of the hospitals in America have left the Medicare program. The other 98.1% have stayed there because I think, despite what they say in the political debate, Medicare pay works out okay for them.
Well,
so why haven't more hospitals left if it's so bad?
I think, Rob, it works out okay because the system is basically cost shifted and they've got third parties, they've got private carriers that are willing to overcompensate. But if that goes away, and as CBO says, if you put the public option into place, millions of Americans will lose their private coverage, then that's not there as a
CBO
step.
says the opposite. They say that under the House
bill,
they say under the House bill, more people have private coverage 10 years from now than do today. That's exactly what they say.
Congressman Jackson?
The president makes the argument that the private sector can exist with the public sector. That is, that public universities can coexist along with private institutions. I make the argument that Federal Express and UPS can survive in the context of a functioning post office. The goal here is to go places where health care presently does not go, to the barrios, the ghettos, the trailer parks, the working class, people who are transitioning between their jobs.
The post office lost over $2 billion last quarter.
I'm sorry, Becky?
The post office lost over $2 billion last quarter.
The post office isn't the most perfect example, but the point is it can survive in the context of a competitive market, and so can a public option.
All right, Congressman Jackson, we want to thank you very much for your time today, sir.
Good day, Jesse.
Thanks, Jesse.
Thank you, Becky. Thanks, Joe. Thanks, Peter.